So I'll tell you a little bit about it, what it is. This is a definition by a cognitive remediation expert group that convened a few years ago, and it's a behavioural training-based intervention that aims to improve thinking skills like attention memory with the general aim of durable effects on community function, things like work, and I think that's probably the most important outcome really in the community function. So I'm going to say, so how can we improve the employment outcomes? Well, this is a review in the last 5 years that looked at things that predicted how well people did in work and employment with mental health problems. And they noted that there had been a real surge in interest in the role of cognitive function. And by cognitive function, I don't mean thoughts and beliefs. I mean things like memory, concentration, the ability to be organised and plan things. So sort of everyday thinking skills. And that's received overwhelming support as a really big predictor of how well people do in employment. So we know that there's an important relationship between thinking and functioning, and this has been the really driving factor why cognitive remediation was developed. One of the things that sometimes people talk about is, well, this doesn't account for the fact that these difficulties might be to do with trauma, and isn't this all a bit based on the medical model? Well, actually, no, I don't think it is. I mean, I think this is based on research showing that cognitive problems are present in people with psychosis, and they really predict how well people recover. And cognitive remediation teaches that these cognitive problems are very normal. We all have cognitive problems at different times in our life. It's associated with ageing and so on. And that we look at the sorts of factors that can cause problems in thinking and help people to find their own ways of managing those difficulties, particularly using strategies, for example. There's been loads of different cognitive remediation programs, often with the computer, not always, with all kinds of different emphases, and I think that's been one of the difficult things to compare how well they work. I'm going to just show you a few tasks from the one that we use in London, just to give you a flavour of the sorts of things that you might do in a cognitive remediation programme. So we start off with very gentle tasks that are not based in the real world, just to get people having the feel of what it's like to do some of these thinking skills and start to think. This is a maze task, where you basically have to work out your route to get to the arrow. And often what you might see is people are very impulsive and get started without thinking it through, and then find themselves in all kinds of trouble, or some people get stuck and they're not sure what to do next. So this is another way of thinking about how you can help people to plan and think things through before they get started. As we move through the programme, we become more ecologically valid, which means, more close to the real world, if you like, and we might ask people to bring in stuff from home, so maps they might of their local area, or stuff they're working on at college, or a book they're reading, or we might help people to concentrate a bit more on watching TV, for example. But this is a task where you see your position on the map on the right-hand side, and then you see yourself moving through the village on the left, so you kind of move around the town, and then you have to work out where you've got to on the map. So again, you need to have some strategies to do that. You might be switching your attention from one thing to the other, You might be using your finger to point. So very simple everyday strategies that probably all of us do without thinking, but that we know that people with mental health problems often don't use those sorts of strategies, and that causes problems. And this is one about shopping. So you've got some instructions in the middle here about what you want to get from your shopping list, and then you've got to add them up and get the total. So you have to use your memory, your concentration, planning, and then all kinds of strategies like writing things down, asking people for help, keeping a list, those sorts of things. Research, even from the general population, is very clear in that none of us are good at transferring one new skill into a different situation. They tend to be very context dependent. And so cognitive remediation programs have thought about how to do this in different sorts of ways. Circuits, which is the one that we do in London, we try to build in a lot of this transfer into the therapy itself. So we help people to think about their goals and how they're going to use these new strategies in everyday life. Other people, I know you do this a lot in FEET, and you're providing bridging groups, so helping people think through I've got these new strategies, where I'm going to use them, and they're done in separate arenas from the cognitive tasks. Well, it's interesting because the literature is at the stage where this is now really, really important. I think Scotland and New York State were the first places to include recommendations that cognitive remediation should be included in general health services in guidelines. But France and Spain have now joined you, and soon it's going to be adopted in Australia and Japan and Canada. So you can see we're at a stage where people are saying now, like, this does work, how can we implement it? And actually finding out what happens in practice and how we can implement this to actually work in the real world as opposed to these randomised controlled trials is really what the literature and, the communities are thinking about.
So how long have you been involved in CRT and what sparked your interest?
Okay. Well, I first got involved I think it was in 1994 when I was doing assistant psychologist jobs before, as part of getting into clinical psychology training. And I got a job on a research trial that was investigating cognitive remediation, one of the really first trials. And I was one of the therapists. It was a really small trial, and one of the people who was really pioneering and developing cognitive remediation for psychosis came over from Australia and taught me how to do it. And I really enjoyed that year of working with people. I think it's a lovely way to work with people in a way that's very non-stigmatising. It's a very gentle way where you can develop a relationship working on things that are really important to people.
So what I've tried to do is to pull out the policy documents in Scotland that relate to mental health, the NHS. And when we talk about employment within the NHS, it's predominantly the allied health professions that they relate to, and within mental health, it's predominantly occupational therapists within the NHS in mental health services who are at the front of employment services. I've also tried to pull out some documents that relate to employment in relation to our third sector partners, because again, a lot of the employment services and projects within mental health are delivered in partnership and through lots of co-production and joint effort and collaboration. So I want to make sure that I try and capture some of that. My task in the next 10 or so minutes is to try and give you a whistle-stop tour history of that to say where we are at. So, diving in. I don't have a presentation, I have show and tell. Within Fife, I was looking at the historical stuff that I have in my cupboard. I'm sure everybody has a cupboard like that. And I came across an old document that we produced in 1996, a collaborative project with Fife Employment Access Trust. There was Sam H, there was NHS Fife, where we were looking at employability for mental health and trying to work in collaboration with each other back in 96. And yet when you start to look at the policies in relation to mental health and employment and psychological therapies, you didn't really start to see stuff until 2004. So a lot of what was happening on the coalface, we were dealing with, you know, as probably a lot of you in the audience were, dealing with supporting individuals with mental health issues into work way before it became a political issue. So I kind of like to think that at the coalface we have, you know, a strength if we collectively work together to push and drive policy rather than being snowed under by it all the time.
So what do you feel the main barriers are?
I think the main barrier at the moment is the local implementation of the strategies. We're certainly not in the same situation within local NHS boards as we are at the Scottish Government. Local NHSs are not really getting the fact that employability is their business. And because of the current financial constraints, they're looking at, well, what is the NHS's core business? And sometimes they miss the crucial fact that employability is the NHS's core business as well. For people.
So what do you think needs to happen to make a change in that situation?
I think what we need to be doing is, at the coalface, really grabbing onto the new strategy documents, grabbing onto the buy-in that we have from the Scottish Government end of things, and use that as a catalyst to start the conversations and discussions locally within the NHS. And for the parts of the NHS that do get the employability as their business, like the allied health professions and in particular the occupational therapists and mental health, we need to use that work as the good evidence of this is how it does work in reality, because we've got enough really good examples in Fife to do that.
So Employer Mind is a partnership project between Fife Employment Access Trust and NHS Fife. And it's a personal development and employability project aimed at individuals with severe and enduring mental health problems. So Employer Mind works by the team at Feet, the Employer Mind team. We take our service to an NHS team and we bolt our service onto an existing NHS team, so like a mental health team. And we deliver it in partnership for the 6-month duration. The project is split into 4 different phases, each phase lasting 6 weeks, and there's 2 weeks between each phase, so our students get 2-week holidays. So CRT is embedded throughout the project. So in phase 1, we begin to sow the seeds of CRT and we begin to introduce it to our students, but really the main delivery is in phases 2 to 4. And really many of our students have had a negative experience of a learning environment or a work environment. So really the main kind of aim at Employer Mind is to allow our students to experience some success and to create a positive learning environment. So it's a really flexible project where we can do that to meet the needs of our students. And really the overall aim of Employer Mind is to enable our students to explore their work-related goals, to improve their confidence and their skills, to develop strategies. And also with it being a partnership project, there's lots of opportunity for knowledge and experiential exchange between FEAT and NHS Fife. So often we deliver sort of training to each other, or we would have access to each other's sort of training opportunities, as well as being able to create innovations within the project. So one of those innovations was the creation of a sort of student-centred risk assessment called Employer Mind, where the kind of student leads that process, and they keep a copy of that form in their project folder, so they really kind of have ownership of how they want to be supported when they're on the project. Okay, so the project also led to the creation of new posts. So we have 5 learning coaches that deliver the project. And learning coaches are really skilled in the delivery of cognitive remediation therapy, of evaluating individual learning style and assessing task approach. And what we find is that often students who maybe don't want to talk about their mental health or talk about symptoms, they're actually very open to talking about their cognitive skills, because it's something that we all have, and it's something that we all identify as, if you're not so good at focusing on something, you can really understand why that makes doing things difficult. So it's a really kind of normalising conversation to have with students. So CRT is not only enhances cognitive skills, but it also provides our students an experience of success, an experience of sticking with something when it gets tough, and therefore it empowers our students to feel competent to tackle their everyday valued goals, like working towards employment. CRT provided within an employability project can be a really powerful step in the recovery process.
And Kate, you've been delivering cognitive remediation outside, haven't you?
Yeah,
so why
that's
don't you tell me a bit more about that project?
Yep, sure. Well, I think the project came about because feedback from the Employer Mind project was that some people found the classroom environment a wee bit difficult to be in. It wasn't best suited for their learning. Maybe they had bad experiences in the past. So we decided to take the Employer Mind project outside, and the project was called Grow Your Mind. And we had to think about different ways of developing CRT when we're out there. We also found it very beneficial to use CRT in relation to the outdoor tasks that we're doing. So it could be in relation to felling trees, and we would think, okay, what strategies do we have to use in terms of health and safety? So it could even be basic things such as making sure we're listening to conversations, making sure we're stopping, thinking what we've got to do, and then planning the task through properly.
So what do you think some of the benefits of that outdoor environment have been?
Well, I think it's widely known that being in the outdoors is highly beneficial to anybody in terms of mental health or just general well-being. So I think that was great. And it was also great to see the clients away from the hospital environment. I think it meant that, okay, so in offices they're away from the hospital environment, less of a label, but then outdoors they're even more away, and away from the kind of stigma and the label of a mental health diagnosis. So I could definitely see how CRT was very successful in an outdoor environment. I think having that immediate feedback as well from learning strategies, and then be able to use that directly on rural skills was highly beneficial for the clients.
Great.
So how do you think it's gone today, Duncan?
I think it's going brilliant, I mean, it's better than I expected, I would say. And I think my highlight so far, I think, was Claire Reader when she said that this service that we're providing is leading the way in the world, or words to that effect.
That was really exciting to hear, wasn't it? My favourite bit, actually, I really enjoyed Claire's talk, but it was nice to see Inga speaking about it with such passion and enthusiasm for the project that we've all worked on for so many years, and to see it locally happening, you know, was really exciting for me.